New tonight, advocates for those who are recovering from substance abuse want Oregon's government to help them support those struggling during the pandemic. They say without help, we're looking at a possible spike in relapses statewide. KML Stephanie Rothman is in the studio with more. Stephanie.
That's right, Jackie. When you take a group of people already starting to stay afloat and you add all that comes with the pandemic, the potential for another health crisis could be just around the corner. I spoke to Oregon Recovers to break down what their new proposal could mean for former addicts. Most people relax with a glass of wine or a pint of beer, but for those in recovery, that's just not the case. What they need to stay on track is support.
We've seen the complete deconstruction of the recovery system in this crisis. To then throw alcohol into the mix and make alcohol more available is just, it's bad public health policy.
That's why Oregon Recovers is working to change that. The nonprofit sent a proposal to the Oregon Health Authority, hoping to help a community where many are struggling. This as alcohol consumption is on the rise. According to Oregon Liquor Control Commission, alcohol sales were up 20% in March, the highest month on record. One of the main goals of the new proposal is to provide more funding and clear guidelines for volunteer-run support groups such as Alcoholics Anonymous.
For people to be cut off in different ways from their support and be isolated in their homes, on top of how stressful the world is that we're living in right now, it can really be difficult.
Doug Smith with Serenity Lane says although many patients are happy with telesupport groups, without face-to-face interaction, many could soon be in trouble.
They've been doing Zoom 12-step meetings and they're starting to talk about, can I go to some of the face-to-face ones hopefully here soon? And feeling a little safer that certain guidelines are going to be practiced, I think would be helpful with that.
If approved, the state would lay out clear guidelines on how to restart.
If they don't have criteria, and we as a group of volunteers don't have criteria, it's just going to be a mess in terms of trying to figure out when to come to agreement.
Helping those in recovery regain their support network. All right, well, it's unclear how long until Oregon Recovers gets feedback from the state. They do hope to have some sort of guidelines to help patients as soon as possible. Jackie, back to you.
Stephanie, thank you.